Good evening and welcome to absolutely everybody to the Hope for ME and Fibromyalgia conference here in Northern Ireland, delivering together the new NICE guidelines for ME CFS, exploring patient safety and healthcare inequalities. My name is Linda Campbell, and my professional background is that of being an advanced nurse practitioner in primary care. I am the charity chairperson and healthcare professional educational advisor. I'm the mother of a son who is living with ME for the last 13 years. I want to explain how the charity is addressing the gap in ME education, awareness, services and education, safeguarding. And before I do that, I just want to check you all do have an information pack, and within that you have a number of documents. There also is a questionnaire within it. We would ask you kindly if you could fill that in before you leave tonight and just leave it in the centre of your table. It helps us with the CPD accreditation and also planning for future conference events. And just a note for those of you that maybe indicated at reception that you would like CPD certificate, it will be forwarded to you a few weeks after tonight's event. Also in your pack should be a copy of the World ME Alliance ME fact sheet. This is World ME Day, and this is the second year that the World ME Alliance has produced documentation, and the strap line of their theme this year is ME, the disease where pushing harder can make you sicker. So safeguarding patients is one of the themes of the conference tonight with regards post-exertional malaise. It's also a major objective of the charity, and it is also supported by the new NICE guidelines. And really this needs urgently implemented in Northern Ireland. So on that note of exercise and post-exertional malaise, I thought this quote from David Petrino was really good. If exercise is medicine, you should treat it like medicine. You should understand what the contraindications are, who might have adverse effects of the medicine, and how to dose the medicine effectively for each person. And as you can see, there's some examples of the cardiopulmonary exercise testing. Joan mentioned about the Workwell Foundation, and there is information down on the left-hand side. Please have a wee look at it and share it. The bottom little graph, what do you want to call it, just very simply depicts a cardiopulmonary exercise test with somebody that has ME compared to a normal patient. So NICE guidelines. The charity fully supports the new NICE guidelines. We are registered stakeholders with NICE, and from 2017 we had Sally Birch, who was one of the charity worked on the committee, and she represented the 7,500 patients for ME. She sat on the ME CFS Diagnosis and Management Guidelines Committee. And what the new NICE guidelines, which have now come out in 2021, they've completely reversed the previous ones of 2007. So bottom right, you will see the quote from NICE. So now we should not be offering patients with ME CFS any therapy based on physical activity or exertion as a treatment for ME CFS. Bottom centre, CBT is not a treatment or cure for ME CFS. The potential of treating somebody with graded exercise therapy in the centre shows that you could potentially be bed-bound as a result. And NICE also highlighted that we should recognise that people with ME and CFS may have experienced prejudice and disbelief and feel stigmatised by people who do not understand their illness. And we're delighted to have Professor Brian Hughes here tonight, who is our keynote speaker, and he will be talking in a bit more detail about the NICE guidelines. We also have our Northern Ireland NICE facilitator, Leslie Edgar, who will elaborate a bit more about her role. So, what gap in services do we provide for ME, fibromyalgia, and now one group of long COVID patients? We provide awareness and support for patients and carers, and we do that in a number of ways. We run Zoom monthly meetings with specialist speakers, Meetings are recorded for our bed and housebound patients. We have over 2,000 members on our closed Facebook pages, and members find that of huge support. We have a Facebook announcements page for global research. We have an ME and fibromyalgia app, which the charity developed with Dr. Katrina Dlargy, who is CEO of Tiga Health and is here tonight. And the app focuses on the benefits of early intervention and self-management for patients. We run weekly Zoom craft group sessions and Zoom coffee meetings, and we offer a Happy Hope surprise parcels that are sent out to members who are going through difficult times. And in relation to the craft group, I don't know whether you noticed on your way in at registration, to the right of that is a display of our absolutely wonderful, talented members, volunteers and patients who, through the means of art, managed to display their feelings with regards ME and also with regards post-exertional malaise. And there is also a display out there from Rosie Pigeon from COVID Kids NI, which visually describes how she lives with long COVID. And I'd encourage you all to have a look at those. We have a number of specialist advisors on the charity, medical and otherwise. One is here tonight, Professor Brian Hughes, who you'll hear soon from. They're all noteworthy of mention. One other I will mention is Dr. William Weir, who's an infectious diseases consultant in London, and he runs clinics here in Northern Ireland. We are affiliated to a number of groups and organisations, not only in Northern Ireland, but in UK, Europe and across the world. And I apologise if I've left anybody off the slide. The charity were recognised as breakthrough leaders by and invited to the Northern Ireland Confederation for Health and Social Care, that is NICON, in 2019. And again, we were invited back in 2022, where we showcased our Discover ME video, which you've already seen. Our volunteers, well, the charity is run and supported entirely by volunteer patients and family members. And our volunteers were very honoured and proud to have received the Queen's Award for Voluntary Services in June 21, with special designation due to the work we did during COVID. And this prestigious award is the MBE for voluntary groups and is awarded for life. Our founder, Joan McParland, who has sneaked out of the room, was too unwell, unfortunately, to travel to London to receive the initial award, such is the nature of ME. However, Dr. William Weir and I were delighted to go in her place, and we attended a wonderful garden party at Buckingham Palace this time last year. And then we were officially presented with the award by the Queen's Award for Voluntary Service Reps here in Northern Ireland by an event that was run by Newry and Mourne District Council. And the awards are tucked behind here, but you can view them. But we're very proud to have those awards. We're also very proud as volunteers to wear our badges, and we wear them with honour. We provide professional training and educational events for healthcare professionals and students, and we've been doing that since 2011. And the charity has run over 14 major conferences. We've brought expert global speakers to Northern Ireland. And I mean, they're all noteworthy of mention, but one that Joan highlighted was the 2018 one, First Do No Harm, the one at the bottom right, which was held here in Stormont. Professor Sir Michael McBride, the CMO, gave the opening address and made that famous statement about his concern that ME had not been recognised and nobody should have to fight for the recognition, and it was of great regret to him. In 2018, the charity sponsored Dr. Robin Brown, who is a doctor with ME, quite severe ME, and she runs or organised the Doctors with ME group. She wanted to run an educational event for hospital doctors, which she did. And before she gave them the ME education, she audited their knowledge. And the audit results revealed that the top pie chart was that 82% thought that ME was a psychological illness, and 98% would have offered potentially harmful treatments. The positive out of all of that was that the doctors recognised they needed more education on ME. And then in 2018 and 19, working with Queen's University Centre of Educational Development during medical students' development weeks, the charity hosted 2 screenings of the world-renowned ME educational documentary Unrest in Queen's Film Theatre. Approximately 600 students received ME information packs and watched the film. And out of the students that were surveyed, after watching the film, 99% that they wanted to see ME included in their medical curriculum. We hope to give you some news on that later tonight. In September, between September and October 2021, the charity organised a series of 5 ME webinars with global speakers. And that was hosted by the HSC Clinical Education Centre. It was recorded. The videos of all of those speakers are on the HSC website. And since that was released on the website, the videos of all of that has been viewed 1,850 times. I think that speaks volumes of the demand for education. And that brings us up to date. Discover ME video, produced and directed by Professor Deepa Menclair. We're totally indebted to her for that production. And as she told you, it has won several prestigious awards. And I think you'll all agree, those that have seen it tonight, that it is quite impactful, especially when viewed via the VR headset. And if anybody wants to view it via that or wants us to come to their place of work, we do come to you. Just contact the charity and we're willing to do that. It's not a snail or a slug with its tongue hanging out, although many people might well feel that way many a time. Neither is it how Ricky Gervais has portrayed it, the one where I don't feel like going to work today, although in as percentage of the population, general population, and unfortunately some healthcare professionals, that belief still prevails. So ME is a disabling, chronic, complex, multi-system disease. It was recognised as a neurological disorder by the World Health Organization as far back as 1959. It affects between 17 and 30 million people globally, and in Northern Ireland, around about 7,500 people. Female predominance, as we've already heard tonight. Children and adults equally, approximately 80% triggered by a viral infection, and 40% have a first-degree relative with an autoimmune condition. Prognosis is unknown, but believed to be approximately only 5% recover. There are a number of features of ME, but the cardinal defining feature is that of post-exertional malaise, or PEM, which we've heard about tonight. It's an increase in symptoms following any type of exertion, whether that be physical, cognitive, or emotional. The effects are often delayed by 24 to 48 hours, lasting days to weeks, or even may lead to permanent disability and relapse. ME has 4 levels of severity, the left-hand picture there, mild, moderate, severe, and very severe. We don't really see people with very severe ME. Why? Because they're housebound, they're bedbound. They become extremely ill. Some can't talk. They become palliative. There is no palliative service for them. They're not recognised. And oftentimes many die at home or in hospital. The right-hand graph shows, research shows that people with ME have lower health-related quality of life scores than most other chronic conditions. Significant amongst that is lung cancer, breast cancer, stroke, and rheumatoid arthritis. It's important that we get the diagnosis right, and the NICE guidelines absolutely stress that. And there have been misdiagnoses made over the years. There was a research study carried out in the Newcastle NHS Chronic Fatigue Syndrome Service back in 2008-9. They reviewed their service, and basically they revealed that there was a 40% rate of patients that had been misdiagnosed. So it is important, yes, that we get an early diagnosis, but it needs to be an accurate diagnosis. And then it is also important that we review those patients, and the NICE guidelines allude to that as well, that patients must be reviewed at least every 6 months. And running on the theme of misdiagnosis, there is a huge overlap between ME and fibromyalgia, and there are a number of patients who have both conditions and oftentimes are misdiagnosed. So I think that has to be borne in mind when we see patients with either condition, that we can't rule out that they may possibly have one or the other, or even both. And the big important part of all of this is that if you're offering recommended therapies for people with fibromyalgia that are based on exercise, that could potentially be detrimental to somebody who has ME, because you're then going to potentially induce post-exertional malaise. So we need to screen people accurately. There's a number of online really useful learning resources about ME. There's the ME study PRN module. Doctors with ME, the top right one, have just recently and a few days ago brought out an ME CFS top tips handout. There's the online dialogues for neglected illness videos that have been around for some time and constantly updated, and physios for ME have online resources as well. And some of this information is dotted around the room, so please look at it before you leave tonight. That brings us to research opportunities and studies. The charity is constantly approached by MSc students, both in medicine and psychology, for both ME and fibromyalgia, and this is just an example of one. Top left, this year an MSc student in psychology at Queen's wanted to look at the Discover ME video and see whether she could utilise it as an educational tool for healthcare professionals. And the outcome of her study was that Discover ME has a potential as an educational tool within healthcare to increase knowledge of ME CFS and empathy for those living with the condition, and she hopes to publish her results. Top right, Decode ME study, UK study, can't go without saying it's the largest ever DNA study of ME CFS. It's still recruiting, and it also includes 500 places available for long COVID patients, and the flyers you'll see dotted around the room and on the information table. And bottom right is a survey that I had carried out with ME patients in Northern Ireland in 2020, and it was based on the offer of a potential ME support clinic within general practice. And we'd asked patients really what they would like of that kind of a service. And the graphs, these represents the results. So the top left graph really says that really 93% of people stated that physical health was an area of health and well-being that they needed most support with. And they highlighted symptoms such as post-exertional malaise, extreme fatigue, etc. The bottom graph then was 99% of people indicated that knowledge and understanding of ME would make their consultation with a healthcare professional a much more positive experience. 84% indicated the ability to make you feel safe and believed was of value to them. So it suggests we have a bit of a way to go yet in healthcare professionals. So along the theme of ensuring we make accurate diagnoses and similarities of conditions, we are, and you've heard it tonight already, we are seeing very strong similarities in one group of patients with long COVID to the symptoms of ME. The ME Association produced this picture on the left, which is really good because it does highlight the similarities of conditions of the symptoms. And then on the right-hand side, there are a number of robust research studies that have been carried out over the years. The bit in pink tells us that approximately 80% of people with ME CFS report that symptoms followed a viral infection. The bit below is talking about SARS and MERS and how that's triggered ME CFS. The blue bit below that, preliminary research into long COVID, suggests there are many overlaps with ME CFS. And the important aspect, the top middle box, with regards to physiotherapy, it's just an example. that we need to make sure that we don't treat every person the same that has long COVID or indeed ME, that we need to make sure that we need to identify whether they actually have ME symptoms, otherwise we're going to induce post-exertional malaise, so we need to screen adequately for that. And finally, before I finish and hand over to Rebecca, I just want to leave you with some stark warning words of Dr. Tedros, the WHO Director General.
An estimated 1 in 10 infections results in post-COVID-19 condition, suggesting that hundreds of millions of people will need longer-term care.
So that's the warning for the future. If we're not recognising the condition, we're not making the accurate diagnosis, and we're not preventing post-exertional malaise by offering inappropriate treatments, then we are increasing the risk of more disabled people in the future. Thank you for listening. That concludes my presentation. I want to hand over to Rebecca Logan. You've heard about how Discover ME affects patients' lives. I think you'll find her presentation on her story strikingly similar to those of people with ME. Thank you, Rebecca.